Are you absolutely sure that little white pill in your medicine cabinet is actually your friend? Consider this scenario. Every morning, millions of people across the globe, perhaps even you or your parents, swallow a tiny aspirin tablet with water. They do this with the absolute conviction that they are extending their lives and diligently protecting their hearts. But what if I told you that for a huge number of these individuals, this daily habit is tantamount to playing Russian roulette? In recent years, the medical world has been rocked by startling new evidence, forcing us to completely rethink everything we believed about cardiac aspirin. Today, we are going to uncover the truth. We will examine exactly who this pill genuinely saves and who it might be slowly and silently harming. Prepare yourselves, because some of the facts we reveal may well shock you, perhaps even prompting you to check the contents of your own cabinet immediately. But before we delve into those shocking revelations, let's quickly establish exactly what we are dealing with. Aspirin, or acetyl salicylic acid, is a true veteran of pharmacology. Its history stretches back to the bark of the willow tree, which the ancient Greeks would chew to relieve pain. However, the modern version we recognise today emerged in the late 19th century, courtesy of the Bayer Company. Initially, it was simply used as a painkiller and a fever reducer. Yet, by the mid-20th century, doctors began to notice a surprising side effect. Patients taking aspirin seemed to suffer fewer heart attacks. This discovery transformed a common, inexpensive medicine into the gold standard for cardiovascular disease prevention. It appeared at last that a miracle cure had been found. But, as is often the case in medicine, this medal had a reverse side, a dark truth that medical professionals preferred to only discuss in hushed tones for many years. To truly grasp the gravity of this problem, we need to understand the underlying mechanism, but I promise we will do so clearly and without complicated terminology. Let's imagine your blood vessels as a bustling motorway, and your platelets, those tiny blood cells, as little maintenance crews. Their primary job is to instantly patch up any damage or leaks. If you happen to get a cut, these platelets immediately swarm to the injury site, stick together, and form a patch or a blood clot. This is crucial. It's what stops us from bleeding out. Now think of aspirin as a special kind of lubricant applied to these repair teams. It essentially makes the platelets less sticky. They slide past each other and can't easily clump together. For someone at risk of a heart attack, where a clot might block the blood flow to the heart, this effect is a lifesaver. Aspirin prevents that major traffic jam from forming on our motorway. But now, imagine what happens if those repair crews stop working entirely. Any scratch inside the vessel, even a microscopic one, could turn into a serious issue that your body simply can't patch up by itself. And that is precisely the root cause of the wider problems we need to discuss next. Right, let's move on to the most important distinction you need to remember, once and for all. In medicine, we talk about two concepts: primary prevention and secondary prevention. Now that might sound terribly dull, but I assure you, it is absolutely vital. Secondary prevention is when someone has already suffered a serious event such as a heart attack, perhaps a stroke, or they might have a stent fitted, or have undergone major heart surgery. In these cases, the disease has already shown its face. The enemy is already within, so to speak. Here, the benefit of aspirin is beyond question. It's crucial for preventing a recurrence of that catastrophe. The risk of dying from a second heart attack is far higher than the risk of any potential side effects from the tablet itself. Doctors are absolutely unanimous on this. You must take it. But then we have primary prevention. This is when you are perfectly healthy. You've never had a heart issue in your life, but you start taking aspirin just in case, perhaps because your grandfather always did, or maybe your neighbour suggested it. And this is precisely where the science has performed a dramatic U-turn. Recent studies have clearly shown that for healthy individuals, the risk associated with taking aspirin often outweigh any potential benefit. I want to bring up what I consider to be a real watershed moment. Back in 2022, a very influential US disease prevention group issued updated guidelines that truly landed like a bombshell. They stated quite clearly that those over 60 should not start taking aspirin for the primary prevention of cardiovascular disease. Just let that sink in for a moment. For decades, once you hit a certain age milestone, this drug was almost automatically recommended. Now the experts are giving a firm no. And the reason is clear. It all comes down to the statistics, which are absolutely merciless. The number of heart attacks prevented in otherwise healthy older adults was found to be vanishingly small when weighed against the severe internal bleeding episodes caused by the medication. It's the classic case of the cure being worse than the disease. The attempt to prevent a fire is doing more damage to the house than the flames themselves, which frankly might never have even ignited. But what about those who are middle-aged? The cohort between 40 and 59 falls firmly into what's known as the grey area. In this range, the medical advice is, everything is highly individual. If you are over 40 and are considering taking daily low-dose aspirin for heart protection, you simply cannot just go and buy it off the shelf. That decision must be made with a full risk calculation assessment in hand. Your doctor must properly evaluate your cholesterol levels, blood pressure, the presence of diabetes, your smoking habits, and your family medical history. If the risk of suffering a heart attack in the next 10 years exceeds 10%, only then may a clinician consider prescribing aspirin. Even in that situation, however, it remains a delicate balancing act. For this specific age group, the overall benefit of taking aspirin for primary prevention is considered modest. In other words, you will be taking pills every single day for years, yet your health gain will be minimal, while the risk of internal bleeding simply never goes away. Let's now talk about the main enemy we're essentially feeding every time we take aspirin: gastrointestinal bleeding. Our stomach is full of strong acid, making it a very aggressive environment. Thankfully, the walls are coated with a protective layer, which is maintained by specific enzymes. Aspirin is famous for blocking the blood clotting cells, but unfortunately, it also blocks those very enzymes that protect the stomach. So, that crucial protective lining can't do its job, leaving the stomach completely exposed to its own acid. Think of it like taking off your body armor right before a fight. Eventually, this leads to erosions and painful ulcers forming. The most frightening thing is that these ulcers can be completely silent. You won't feel the typical stomach pain or heartburn. The first sign you get could be sudden, extreme weakness, or even worse, vomiting something that looks like coffee grounds, or passing black tarry stools. These are signs of a massive bleed that is already underway. For older people, getting to this point can unfortunately be fatal. But the stomach isn't the only concern here. There is a much more serious risk, even though it's less common. I'm talking about hemorrhagic stroke. We are used to thinking that aspirin protects us from strokes. And that's true, but only for ischemic strokes, the kind caused when a blood clot blocks an artery in the brain. Aspirin helps prevent those clots from forming. But there is a second type of stroke, a hemorrhagic stroke. This is where a blood vessel bursts in the brain, causing bleeding. If you are taking aspirin, your blood doesn't clot as effectively. If that vessel bursts, perhaps due to a sudden spike in blood pressure, it becomes incredibly difficult for the body to stop that bleeding. The blood will simply flood the brain tissue. This creates a genuine paradox. By trying to protect ourselves from one type of stroke, we are, even if only slightly, increasing the risk of the other, more deadly kind. Now, many of you might be thinking, but I take that special enteric-coated cardio aspirin. It dissolves lower down, in the intestine, so surely it's safe for my stomach. I'm afraid this is one of the most stubborn myths going around today. Marketers have done a sterling job of creating a powerful illusion of safety. Yes, the special coating does protect your stomach lining from direct contact with the tablet's acidity. However, cast your mind back to the mechanism of action we discussed earlier. Aspirin is absorbed into the bloodstream and acts systemically, that is, throughout your entire body. It suppresses the production of protective prostaglandins everywhere, and that critically includes the stomach. In other words, it really doesn't matter where the tablet dissolved. The damage to your stomach's vital protective layer is still delivered via the blood. Large-scale clinical trials involving thousands of patients have clearly shown no significant difference in the frequency of gastrointestinal bleeding between standard aspirin and the coated version. So please don't let fancy packaging fool you into a false sense of security. Another point, and this is absolutely critical, is the dosage itself. In many places, especially America and mainland Europe, the standard for preventative treatment is often 81 milligrams, the so-called baby aspirin. However, here in the UK, we typically see prescriptions for 75 or 100 milligrams. And here's the key rule. More does not mean better. For the preventative effect you need, that is, just enough to gently dampen the activity of your platelets, the minimum dose is sufficient. If you increase the dose to 325 or 500 milligrams, like the standard tablet you might take for a bad headache, you do not get better heart protection. Instead, you dramatically, even catastrophically, increase your risk of severe bleeding. If you are taking aspirin specifically for your heart, please make absolutely certain you are taking the low-dose version. Trying to split a regular aspirin tablet in half is a really bad idea. You will never accurately break off the right dose, and the amount you are taking will fluctuate wildly from one day to the next. Now, what if you're taking regular painkillers for something like arthritis or a bad back? This is where we run into a potentially dangerous conflict. Medications like ibuprofen or naproxen belong to the same family of drugs as aspirin. If you take ibuprofen, it essentially rushes ahead and tries to grab a spot on your blood platelets, the very spot that your low-dose aspirin needs. The problem is, when your vital aspirin finally gets there, that crucial parking space is already taken. It can't do its job properly. This means your heart protection is effectively switched off. If you find you absolutely must take a non-aspirin painkiller, the official medical advice is to wait at least 2 hours after you have taken your daily aspirin. However, the safest and best course of action, especially if you have a known heart condition, is to discuss your pain management plan with your GP. You need to ensure you don't accidentally neutralize the effect of a medication that is literally keeping you safe. Now let's talk about alcohol. You might be wondering what the connection is here, but trust me, it's a vital one. The combination of aspirin and alcohol is frankly a disastrous mix for your stomach. It's truly a Molotov cocktail, if you will. Alcohol, on its own, is highly irritating to the stomach lining. And as we know, aspirin actively removes that natural protective layer, making bleeding much more likely. If you regularly consume alcohol, even in very moderate amounts, while taking daily aspirin, your risk of a serious stomach bleed goes up significantly, many times over in fact. Furthermore, there is clear evidence that alcohol can actually increase the overall time it takes for bleeding to stop. Therefore, if your routine involves taking your morning aspirin and then enjoying a glass of wine with your evening meal, that habit absolutely needs serious reconsideration. You should certainly discuss this with your doctor or a gastroenterologist immediately. There is another phenomenon, or perhaps we should call it an issue, that few people are truly aware of. Aspirin resistance. Just imagine, you dutifully take your daily tablet, you put up with the potential side effects, and yet, the medication simply isn't doing its job. According to various data, anywhere between 10 and 30% of patients might be entirely unresponsive to aspirin's protective effects. Their platelets continue to stick together, completely ignoring the medication. This resistance can be linked to factors like genetics, diabetes, or carrying extra weight. The result is a worrying situation where a person lives with a false sense of security, believing they are protected, when in fact they are not. Doctors usually only suspect this condition if a patient suffers a repeat clotting event or thrombosis while they are strictly following their prescription regimen. In these cases, the aspirin is promptly swapped out for different antiplatelet medications. However, finding out if you are resistant beforehand is virtually impossible without very specific diagnostic tests. High blood pressure or hypertension is a major and particularly risky topic when we talk about aspirin. If your blood pressure isn't well controlled, meaning those readings are regularly bouncing up above 140 or 150, then taking aspirin is essentially playing with fire. High blood pressure already puts immense strain on your blood vessel walls, particularly those in the brain. When you then add blood thinning into the mix, the risk of a hemorrhagic stroke, the type we mentioned earlier, absolutely skyrockets. This brings us to the cardiologist's golden rule. You must stabilise your blood pressure first. Only once it's properly under control should you then, if necessary, discuss the need for aspirin with your doctor. Taking aspirin when your pressure isn't monitored or controlled is strictly forbidden. But what about diabetics? It was once thought that a diagnosis of diabetes automatically meant one should start taking aspirin, simply because these patients face an elevated risk of heart issues. However, recent major trials, such as the ASCEND study, have yielded rather mixed results. While aspirin did reduce the risk of serious vascular events in diabetics, it also significantly increased the risk of major bleeding incidents. The scientific consensus was stark. Routine prescription of aspirin for all diabetics is no longer recommended. Every case must now be assessed individually. If a diabetic patient has no clear existing heart disease, the potential harm may well outweigh the benefit. This is yet another example of how modern medicine is moving away from blanket prescriptions towards a highly personalised approach. Let's turn our attention to women for a moment. For years, most of the key research into aspirin was done primarily on men. The assumption was that the female heart simply behaved in the same way. However, it turns out there are critical differences, some real nuances. For women, aspirin seems more effective at preventing ischemic stroke, whereas in men, it works better for preventing a myocardial infarction or heart attack. This is believed to be down to differences in hormonal factors and the underlying structure of their blood vessels. Crucially, though, women often face a higher risk of bleeding, particularly as they get older. The female system can be more vulnerable when reacting to antiplatelet drugs. That's why women, especially those over the age of 65, must exercise double caution and only begin taking this medication after a clear discussion with their GP and for a very compelling medical reason. There is another hidden danger, and it's called the withdrawal effect or the rebound effect. A lot of people decide to stop taking their daily aspirin abruptly. They might think, "Oh, I'm fed up, I keep forgetting my dose, and anyway, my stomach is starting to hurt." And they stop it all in one day. This is a huge mistake. When you suddenly remove that brake controlling your platelets, your body can overreact. The platelets can actually become even stickier than they were before you started the treatment. This temporarily spikes your risk of dangerous blood clots in the first few weeks after stopping. If you decide it's time to discontinue aspirin, you must do it gradually and always under the guidance of your doctor. This might involve temporarily switching you to an alternative medication or slowly reducing how often you take it. What should you do about medication before seeing the dentist or going in for scheduled surgery? That's the million-dollar question, isn't it? Years ago, surgeons always insisted you stop taking aspirin a full week before any procedure. However, the approach has definitely changed now. For minor stuff, say a simple tooth extraction or quick cataract operation, you often don't need to stop taking it at all. Why? Because the risk of forming a serious blood clot actually outweighs the risk of a minor bleed, which they can easily control when pulling a tooth. But if you're facing major surgery, something serious on the abdomen, or the brain for example, discontinuing aspirin is usually mandatory. In these serious cases, the surgeon and your cardiologist will always make that decision together. The absolute golden rule is this: never ever hide the fact that you take aspirin from your doctor, even if you think the dose is tiny. Being completely honest could very well save your life when you're on the operating table. We are often asked, is there a natural alternative to aspirin? Many people look to omega-3 supplements, turmeric, garlic, or perhaps just drinking plenty of water for a solution. Now let's be honest about this. Staying well hydrated is excellent. Having thick blood from dehydration certainly isn't good. However, neither water, nor fish oil, nor garlic possesses the proven anti-clotting action that is comparable to aspirin. They simply cannot switch off platelet aggregation in the way that proven pharmacological treatments can. Relying on dietary supplements as a full replacement for prescribed medication, especially when you face a high risk of heart attack, is a form of self-deception that could prove incredibly costly. Natural remedies are wonderful for overall well-being and general strength, but they are not the tools we use to block a critical clot. We also need to touch upon the combination of medications known as dual antiplatelet therapy. This is where a patient is prescribed aspirin alongside a second drug, such as clopidogrel. This combination delivers an extremely powerful effect on your blood's ability to clot. This regimen is typically prescribed for a full year after a stent has been put in place. During this critical period, the patient becomes incredibly fragile. We often say they are made of glass. A simple bump or knock will result in a huge bruise, and even a minor cut will take a long time to stop bleeding. Maximum supervision and control are absolutely essential during this time. If you unilaterally decide to stop taking just one of these medications, it can instantly lead to stent thrombosis, a clot, which can prove fatal. Conversely, an overdose can result in life-threatening bleeding. This represents the highest level of modern cardiology, and there is simply no room whatsoever for taking matters into your own hands. Here is an interesting and important point regarding gout. If you are dealing with this painful condition, you really ought to be aware of how common medications can interact. Specifically, low-dose aspirin, the kind often prescribed to protect the heart, can actually stop your kidneys from clearing uric acid properly. This build-up, in turn, could trigger a severe gout flare-up or significantly worsen the overall disease. It creates a classic vicious circle. We treat the heart, but we inadvertently cause problems for the joints. Because of this complication, doctors have to work extremely carefully, often seeking alternative treatments or fine-tuning the current therapy while constantly monitoring your uric acid levels. Ultimately, this situation proves once again that everything in the human body is deeply interconnected. There is simply no way to treat one system in isolation without influencing the others. Right then, let's sum all this up in the form of a quick checklist. Aspirin is not a general vitamin, nor is it something you simply add to your daily tea. It is a powerful, serious medication with systemic effects throughout the body. If you have already suffered a heart attack, had a stroke, or have a stent fitted, then aspirin is certainly your ally, and the benefits far outweigh the potential risks. However, if you are otherwise healthy and are just worried about your heart, the likelihood of aspirin doing you harm is actually greater than the likelihood of it saving you. Stomach erosion, hidden internal bleeding, and the risk of a hemorrhagic stroke. This is the real cost of unjustified preventative measures. Remember, medical science never stands still. What was considered absolute truth 10 years ago may now be recognised as an outdated approach. Ultimately, your health is in your hands, supported by the knowledge you now possess. All this information points to one simple, yet incredibly important conclusion. The days of popping aspirin, just in case, or for general health, are officially over. We've learned that this small tablet has the power both to save lives and, when used incorrectly, to cause serious problems. Medicine has reached a tipping point, and the new guidelines, especially those updated in 2022, confirm this shift. The main takeaway from this whole discussion is straightforward. Please do not start taking aspirin on your own. If you've been taking it for years, don't stop cold turkey. Instead, book an appointment with your GP or cardiologist and ask this vital question. Given the latest evidence, is this still the right treatment for me? That simple conversation could be crucial in saving you from complications, whether it's an ulcer or a serious stroke. Thank you so much for watching this whole segment. If this information was helpful, perhaps opening your eyes to something you thought was routine, please do hit the like button. Liking the video ensures it reaches others who urgently need this crucial medical advice. Subscribe to the channel to keep getting sensible, myth-free medical insights. And finally, let me know in the comments below, Are you or your loved ones currently taking aspirin purely for preventative reasons? And most importantly, have you discussed the potential risks with your doctor? Let's continue the discussion down below.